We are going to be tackling a little bit more of a complex subject today about essential oils that have just come out in a study that talk about their ability to potentially be protective against COVID. So of course, we all know that this is a huge concern in our world right now, and there's so many opinions that are flying around about this thing, right? I'm not interested in engaging with opinions in today's podcast. Today, I'm just interested in bringing you a little bit of the most recent research that's come out from the essential oil standpoint of things, just to give you an idea of the things that are supported scientifically. But I want to preface this entire discussion by being very, very clear that I am not giving you any medical advice here. Okay, you need to be talking with your physician, with a qualified doctor if you have concerns about your health. Aromatherapy is not intended to diagnose, treat, or cure any disease. And if you have someone or a resource telling you that, I encourage you to use critical thinking and become very suspicious of that. Having said all of that, what we do know is that there is a large body of research regarding essential oils and our health and wellness. You can simply go to PubMed and do a search for yourself. In fact, just try it, go out and search lavender essential oil, and you'll see that there's truly a lot of peer-reviewed research that is being done on essential oils. Now, with COVID specifically, I think that the fact that this thing has come up so quickly and that there's so many unknowns about it is causing people to look a large variety of places to find answers for themselves, to figure out how to support their health, to figure out how to prevent this thing, to figure out how to support the immune system, how to boost the immune system. Do we want to be boosting the immune system with this particular virus? And there truly are so many unknowns. So what I'm going to share with you today is simply research-based information. And I want to be clear with that there is a limit to this right now. We are still very new into understanding how COVID works, but I'm going to give you a little bit of an insight into that today, along with sharing the research. After that, we're going to talk about the two essential oils that were discussed in the study that we're going to be talking about. That is lemon essential oil and geranium essential oil. Now, I have to say, having worked with essential oils for a long time, I was thinking that the essential oils that would be the most protective against something like COVID would be the ones that I usually go for, which are the essential oils usually from the eucalyptus family or any tree essential oil. What was interesting about this study is that lemon and geranium emerged, and they are not ones that I necessarily would choose as my first picks for supporting the body through colds and flus. So this is part one of a two-part series. The second podcast that I'm going to do about this later this week, so be watching for that, is going to be about some additional essential oils that are not supported in this particular study, but which we have in aromatherapy traditionally used to help to support respiration and breathing, which is one of the primary concerns with COVID. The essential oils, however, that we're going to be discussing today are important because of their preventative abilities. So these are essential oils, the lemon and the geranium, that you would use before you would know that you would have the virus. It would be essential oils that you might be interested in using while you're out and about, having in your vehicle, even diffusing a bit at home, just to give your body an extra boost. So how does that work, right? Like, what is a virus? I know it's not a living thing according to all of the requirements of what living things are, and how is this particular virus getting into our bodies and causing so many issues? So a really simple way to understand this is to know what an ACE2 receptor is. And I'm not going to get into what the long word is for the ACE2 receptor. What I want you to know is that ACE2 receptors are like a keyhole that is found on the outside of several different types of tissues located at several different places throughout the body. They are located in our lung tissue, in our respiratory tract. You can also find them in some nerve tissues, in some heart tissues, and some brain tissues. The important thing to know is that ACE2 is like the keyhole for the SARS-CoV-2 virus. So this virus comes along, it gets into our respiratory tract, and it has places that it can plug into. Now, depending on your genetics, you may have more or less of the ACE2 receptors. And one of the things that they need to find out in the studies is, does that matter? Does it make a difference? There seems to be indication that it does, but we don't have that scientific proof yet. What we do know is that SARS-CoV comes along, it plugs itself into that keyhole, and that is how it invades our cells. When we're talking about something that would then be antiviral against COVID, what we would be looking at on the very basic level is something that would be able to inhibit that virus's ability to plug into those receptors. So the ACE2 receptor that is in those tissues has the ability to allow that virus in. There's a lot of other functions, good functions, that the ACE2 does for us later on in the disease process. So one of the things I've been finding as I've been researching essential oils and herbs for supporting the body during the experience of coronavirus is that some essential oils and herbs are going to be ones that are purely preventative. Then there's a group of them that would be ones that we would want to use during the very beginnings of the disease process. But those same essential oils or herbs, we may not want to use. And in fact, a lot of them we should not want to use during those later disease processes, the ones that are the scary sort of extreme lung complications, where the lung is filling up with too much hyaluronic acid, and there's the extreme breathing distress, and then the distress on the other organs, very often ones with the ACE2 receptors, right? So what I'm talking about today with the lemon and the geranium, from my viewpoint, after looking at the literature, from my opinion, again, this is opinion, not medical advice, is that geranium and lemon are ones that we're going to want to use purely preventatively. The reason is that there comes a point in this disease process where it seems that we would not want to have anything extra in those ACE2 receptors, whether it's a virus or an essential oil inhibiting the virus, because those receptors need to do other things in their jobs. Now, again, these are things that are just in the very beginning stages of being studied. This is what I'm being cautious of after reviewing the literature. I don't have any black and white answers for you about that. I'll tell you that where my own comfort level is as a person that even right now is potentially battling coronavirus is that I'm going to use lemon and geranium purely preventatively. Purely when I'm out and about where I may be exposed to a higher viral load from the environment that I'm in, I'm going to be using these essential oils during those times. I will also be using geranium and lemon in my home, possibly after that exposure, or if someone happens to come into my home just to clear and clean the air and to help my body with any potential viral load that I may or may not have been exposed to. Okay, so this is kind of like a speculative, preventative way of looking at how we use these essential oils. So how lemon and geranium work when it comes to possible prevention of this drug can be, of this virus can be found in a recent study that was published in the journal called Plants. Pretty straightforward journal name, right? And it was published in June. And it talks about how in the study, they evaluated the ACE2 receptor inhibitory effects of 10 different essential oils. And of those 10 essential oils, the geranium and the lemon essential oils displayed significant ACE2 inhibitory effects in the epithelial cells, which are those cells that have the ACE2 receptors on them. And as they looked at that, they saw that there was 22 different compounds in the geranium oil that were looked at and 9 compounds in the lemon oil that were looked at. And of those compounds, limonene was very, very powerful. And also they looked at citronellol, geraniol, and neryl acetate from the geranium. So these are compounds within the essential oils that are a higher percentage of the compounds within the essential oil itself. And they have those abilities then to plug into those ACE2 receptors. And that means that you can't put two keys in a keyhole at the same time. That virus then can't invade those cells when they are plugged with these other compounds from the essential oils. And the study concluded that geranium and lemon essential oils and their derivative compounds are valuable natural antiviral agents that may contribute to the prevention of the invasion of SARS-CoV-2/COVID-19 into the human body. So again, this study was not looking at, can lemon and geranium essential oil help the body once the virus has invaded? So once you have the active disease process happening, that's not what this study was looking at. This study was purely looking at, can we find like a goalie for our goal? Like, I'm giving you a sports analogy, which is so unlike me. But we need some goalies to block our ACE2 receptors to keep this thing out of our body. And that's what the geranium and the lemon essential oil and particular compounds within them seem to have the ability to do. Now, again, this is just one study. Science needs to be repeated in order to be confirmed, but it is a promising suggestion of things that may be preventative from a natural standpoint that so many of us would be able to take advantage of. Now, how would this actually look like? By what method of application could you do this? Well, I wrote a blog recently about how to make an essential oil inhaler to help support your body when you think you may be exposed to COVID-19. I'm going to be posting a link to that blog in my show notes so that you can do that for yourself at home. I actually even give you a full recipe from me, a certified holistic aromatherapist that is, is calculated and is going to be safe for most people. And what I would suggest is having that essential oil inhaler with you as you're out and about. And yes, please wear your mask, but in between wearing your mask, take some breaths from your inhaler intermittently, and those molecules from the essential oil will then go into your ACE2 receptors, if this research is correct, and will help to keep out the virus invaders. From a home standpoint, what I would recommend is using these essential oils in your diffuser and doing it at about a 1-to-1 ratio. So when we're talking about the strength of essential oils in terms of scent, we talk about something called blending factor. And the blending factor of lemon essential oil versus the blending factor of geranium essential oil, they're very close in strength. So to keep things simple, because I like to help you live a simple, holistic lifestyle with ease, I want you just to do a 1-to-1 ratio. And depending on the size of your space, you're going to use more or less drops. Now, in the space that I'm in, this is a large, open, great room in my home that actually is connected to most of my house. And there's ventilation and there's ceiling fans and all those things. So I will use up to 10 drops total in my diffuser at a time. So that would be 5 of lemon, 5 of geranium, or you could choose to diffuse just 1 at a time. That's completely acceptable as well. I really like geranium and lemon blended together personally. So I would suggest trying that. It's very enjoyable. And I'm going to share with you in just a moment here how to look at geranium and lemon as being more than just supportive for preventing COVID. And in the diffuser, you're going to put those drops that you need according to the size of your space. If you are diffusing in a smaller space, an enclosed space, your own personal office or something like that, honestly, like 1 to 2 drops can be sufficient to get the benefit of this. Some people say, for the purposes of immunity, that you want to do intermittent diffusing, because as you're inhaling those molecules, those receptors get filled up, then the body needs time to sort of process that information, and then the receptors, there's suddenly more of them as the cells divide. So to do it intermittently is more beneficial. Some people say that for something like this, that's not necessarily going to matter. The truth is that we don't know right now. So I would just say diffusing at all is potentially going to be beneficial to you, and try not to overanalyze too much when you're doing that. I definitely encourage you to tune into your body as well and see what your body is telling you about what it needs. And if you know some of the other benefits of these essential oils, it'll help you to make an easier decision about which one or both of them to use. So let's talk about lemon essential oil. It's so crazy that something that is so ubiquitous in our life. I mean, who doesn't have a lemon in their kitchen or lemon juice? We put it in so many things. It's been used in Ayurvedic medicine since forever. It's one of the things that I do every morning is warm water with fresh lemon juice and fresh ginger juice in it. That just helps to detoxify the body, support the liver function. It helps to uplift the spirits, and it helps to hydrate the body. Who would think that something like lemon essential oil would potentially be preventative against something that seems so huge and so scary in our world right now, something like coronavirus? So lemon is high in limonene, which is one of those compounds that was mentioned in the study. Of the lemon essential oil, limonene is anywhere from 66 to 85% of the essential oil. What lemon does, it helps to cleanse and clear space, first of all. This is my primary reason why I would reach for lemon is, say it's winter and the air in the space feels stale, or I just feel like the energy is stuck. Maybe I'm not feeling as productive as I normally feel, like I know I should be feeling. I will reach for lemon essential oil, throw some in the diffuser, and I just feel like it helps to stimulate my mind. It helps to invigorate my ideas. It helps to refresh me. A lot of people find lemon, as well as all of the citrus essential oils, to be very uplifting. So this family of essential oils actually you can look toward for anytime you're feeling sad, maybe in sort of a depressive state. Not that it's going to cure those things, but it's going to help support your body through those things. Always supportive, never curative, okay? A lemon essential oil can also help with lymphatic congestion. And this is an additional way that I believe that possibly lemon can help with any cold, flu, COVID, what have you, because very often what happens is that our lymph stagnates, where we are more sedentary when we're ill, and the lymph needs to be able to move in order to do its job as part of our immune system. So lemon just helps to get that moving as well. So again, we're seeing that lemon helps to get things moving, whether it's our energy, our ideas, the air in the space, the energy in the space. Interestingly, this is one of my favorite uses for lemon. If you have a dislike of exercise, like it's just like innate in you that you don't like to exercise. There are some of us out there, it has to do with your, a couple of things, like your natural constitution type, according to Ayurveda. It probably has to do with your Enneagram as well. Maybe it has to do with your stage of life. Maybe it has to do with your particular physical challenges. Maybe it has to do with just like not having the healthiest relationship with your body. All of those things. If you dislike exercise, I want you to try putting a little bit of lemon essential oil in a diffuser in the space that you exercise in at home. So many of us aren't going to the gym right now, so this is actually a great opportunity to experiment with this and see if that helps to lift the heaviness that you feel, the inertia that you feel against exercise. Lemon can help calm emotional outbursts, so I do recommend it to parents fairly frequently. It helps to reduce kapha. So in Ayurveda, kapha is a state of too much inertia in the body. It's a heavy state in the body. Kapha will present in a lot of different ways. I always think of something like a sinus infection or extreme nasal congestion as being a really good example of kapha congestion or excess kapha in the body. Some of us just naturally will have more kapha in our bodies, and some of us won't, but then it'll be really obvious when we're experiencing it. Usually kapha feels like a heavy dragging feeling and just a general sense of congestion. So lemon can help to move those things. From a traditional Chinese medicine standpoint, we would look to lemon to help our lungs and our body to clear any excess phlegm. Now that would be very tempting to say, well, then that's perfect for coronavirus because so many of us are having that excess congestion. The thing is that it seems like the lung congestion in particular with coronavirus is possibly different functionally, but possibly also different in severity as compared to the regular cold and flu. So this is one of those situations where you have to use your own judgment and see what you have to make that decision for yourself about, is this something that I feel is going to be helpful for me or not? Because right now we just don't know enough. Blending lemon. Okay, so lemon blends with so many different things, but I do like to blend it with other citrus. Especially blending it with florals is one of my favorite. I feel like just like adding lemon to your food makes it tastier, I feel like adding lemon to florals brings out even more of the wonderful floral characteristics that we can enjoy. And geranium being a floral, this is kind of a marriage made in heaven from the enjoyment of a scent aspect of things. And then I feel like lemon blends really well with any tree essential oil, but especially evergreen essential oils. So I would mix lemon and say a silver fir together to help support moods and help support respiration, just as a general tonic to the lungs in my diffuser during the winter season. So that's lemon essential oil. And then geranium. So geranium may be one that we use less of than other essential oils. If you're using essential oils, you probably have used lemon, but maybe not used geranium. So let's just talk first of all about some basic safety information about both of these essential oils so that you can feel confident in using them. Lemon, not a lot of safety precautions when it comes to inhalation of lemon essential oil, but any citrus essential oil can cause photosensitizing on your skin. If you put the essential oil on your skin, even diluted, and then expose yourself to UV rays from the sun or a tanning bed, you will actually have a higher potential of burning your skin. I've seen this happen to people. A good friend of mine actually was putting a citrus essential oil on her face with a carrier oil every day. And I was at her place during summer and her face just kept getting redder and redder and redder every day. And finally I was like, what is going on with your face? And she's like, I have no idea. I'm only using natural things. It should be fine. And I was like, what do you mean you're using natural things? And so she confessed to me she was using citrus essential oil in her facial serum. And I said, you need to stop using that because it's causing photosensitization on your skin. Now, it doesn't mean that it's bad for our skin. It just means that the combination thereof with the citrus essential oil and the sun is something that we want to be cautious of. And when we're talking about geranium and safety, we don't have to worry about the photosensitizing in the combination of the essential oil and the sun, but we do have to worry about sensitization in general, which means that people may be reactive to geranium on their skin because of some of the compounds that are within geranium being ones that a lot of individuals will find that they have some level of reaction to. So what I want to say with this is if you're going to use geranium dermally, you always want to dilute it. The maximum dilution that is recommended by our world authorities, Sistrand and Young, for the geranium essential oil in a serum is 17.5%. So you want to be really careful. If you're going to use it on your skin, use a very small amount, and you can do patch testing, which means that you dilute some of that geranium essential oil in a little bit of carrier oil, and you just put it on a little spot on your skin and you give it some time and see if you have any reaction to it. If you don't have any reaction to it, you're probably fine to put it on your skin in small amounts when it's diluted. And if you want to learn more about essential oil safety in general, I want to refer you to the National Association for Holistic Aromatherapy's website, naha.org. They have an awesome section on essential oil safety that is from an unbiased and science-based standpoint. I really appreciate the work that they do. Okay, so geranium essential oil. We want to be careful about not sensitizing our skin to it, but we also want to be careful not to use it all the time. If we're using it daily, it can build up in our body over time and we will then start to have reactions to it. So geranium, you're not going to put it on your skin every day. You're not going to put it in your diffuser every day, but using it for some purposes or may be supportive in, so we might be talking about COVID prevention, but here's a whole other list of things that you can look at. So I always looked at geranium as a hormone balancer, and this is a big subject. But I was working with geranium a lot about 4 or 5 years ago. There was a couple of years where geranium just kept calling to me. It was a time when my hormones really were kind of out of whack. Also, I was experiencing a lot of anxiety and stress in my body, as well as in my thought life. And I almost had a physical craving for geranium essential oil. This happens in herbalism and in aromatherapy, that there may be times where a specific plant really starts to speak to you. And what I want to encourage you is, if that is happening to you, listen, because plants have their own wisdom, and they work with us on levels I think we aren't even beginning to understand. So I started using a lot of geranium essential oil. I was diffusing it. I was doing a lot of blending with it. I was putting it in my baths, my showers. And I was also changing a lot of things about my nutrition, my herbal protocols. But over time, the hormonal issues that I was having, they really, really resolved for all of those reasons, and I'm sure others. I did find for myself that geranium just seemed to make that whole process easier for me. I reach for geranium when I need a mood boost, when I'm feeling sad, or when I'm feeling anxious, or when I feel like I need some nurturing. Geranium is going to be one of the top ones that I go to. It's harmonizing. So when you're feeling out of harmony, when things are feeling out of balance for you, whatever that is, geranium may potentially be an ally for you. It helps with jet lag. It helps to move the lymph. So this is something it has in common with lemon essential oil. Both of them are going to be helpful to move the lymphatic fluid in the body, keep it from getting stagnant. It helps with PMS. It helps with a wide variety of skin conditions like eczema and psoriasis. Now, those two skin conditions are, I'll tell you as a natural practitioner, the hardest ones. But it's also recommended for things like acne, dry skin. Just make sure that you're using it not every day, and you're always diluting it. Geranium can help with decision making, and what that means is, if you're a person that sits on the fence for a really long time and you struggle to know your own inner sense about how to make the decision, geranium can be an ally for you to help support you to be able to make decisions more quickly and to trust your own inner voice. Love that aspect of it. It can help us to be more receptive, and actually can help us to be more sensual. So if you're feeling frigid, or you're just feeling like you're not receptive to a lot of things in your life, like maybe you're even just moving through life almost like you're observing yourself from the outside, like, I see myself doing these things, but I don't feel anything about it. Geranium can really help to get you plugged into your heart chakra, to your heart center, to your inner wisdom, your inner voice, and to help you to feel like you can be receptive to things that are happening around you. Maybe that's also to be receptive to ideas, to be receptive to people, to be receptive to love, whatever that looks like. Geranium can help with a sense of calm and strength and security. So again, this is something that we reach for. It's an anxiolytic, which helps with those feelings of anxiety that we have in our body. Again, not a cure. This is going to be supportive to you as you're working through your thought patterns and other things physically that are going on that are leading to that anxiety. It helps with stress and overwork, something that so many of us struggle with. It helps us to connect to our emotional life, again, connecting us to our heart chakra. In terms of Ayurveda, it helps to reduce pitta, which is hot, inflamed conditions. And at the same time, interestingly, helps us reduce the opposite, kapha, which is those heavy, wet, inertial conditions that we experience. From a TCM standpoint, traditional Chinese medicine standpoint, we look to geranium to help strengthen our qi, our life force. Awesome. So here's a way that I feel like geranium could be potentially helpful from an energetic standpoint through the entire process of a cold, a flu, possibly even coronavirus, is that it will help just with your body's energetic sense of its own strength, and it helps to clear inflammation from a TCM standpoint. Okay, the particular compounds in geranium in the study about SARS-CoV-2 that were protective from a viral load standpoint was citronellol, which is 20 to 40% of the geranium essential oil, and then geranium, right? 8 to 25%. So what we can learn from that as compared to lemon, which is mostly one compound with a few other small things added in there, geranium is a much more complex essential oil with a large variation of different kinds of compounds in it. And I think you can smell that even when you smell geranium versus smelling lemon, is that lemon's kind of a straight shooter, whereas geranium, just like the flower, it takes time to open up. You experience different things about the scent. What this also means is that geranium, depending on the variety and also the place that it is sourced from, is going to have a difference in the amount of different compounds that are in it. How are you going to know that as the home user? You're probably not, unless you ask your supplier for their material safety data sheet, where they also have done some profiling of what the constituents are of the essential oil. With geranium essential oil, there are some additional safety concerns for individuals on certain types of drugs, such as diabetic drugs. There are some pain drugs and there are some antidepressant drugs, but those cautions are only applied to internal use of geranium essential oil, which is not something that I recommend unless you are working with a clinical aromatherapist that is recommending that for a specific purpose, okay? So just something to know, something to learn about is some of those additional safeties that don't really apply necessarily to this conversation, because we are talking about applying geranium oil through inhalation. Either it's through the inhalation in an inhaler, inhalation through the bottle, just opening the bottle and wafting it out of the bottle, inhalation through your diffuser. These are going to be the most efficient ways to use these essential oils. So I hope this was helpful today. And again, none of this is medical advice. You need to be working with your physician if you have specific concerns or questions that relate specifically to your health. None of this is meant to diagnose, treat, or cure any disease, but it is interesting to see how essential oils can add a component of support to our overall wellness when we're seeking after that more holistic lifestyle. And possibly the emerging research is showing that it can be in some ways protective for us as we are dealing with coronavirus just in the world, and who knows for how long. So the more tools we have in our toolbox, I think the better off we can be, plus the more in sync we are with nature. And whenever we can do that, I truly believe that we will be living a holistic lifestyle with ease, much better and with much more fulfillment. So that's all for now. We'll see you next time.